Hello everyone, welcome to my channel Pediatrics Tutorials. I am Dr Soumita Roy and today I am going to discuss with you a very important topic, that is SAM. So what is SAM, students? Yes, it is severe acute malnutrition, right? So why I have taken up this topic? Because SAM is a very important topic from your exam point of view, and you are going to face a lot of questions both in your theory and practical from SAM, right? And one more thing, students, I'm going to discuss the important questions at the end of my lecture. Okay, so be with me throughout the lecture so that all your questions get answered, right? So what's the definition? Severe wasting and or bilateral edema, right? So students, try to focus on each of the words whatever I am saying. You see, I have written severe wasting and or bilateral edema, bilateral pedal edema, of course, yes. And what do you mean by severe wasting? So WHO defines severe wasting as weight for height less than 3 standard deviation, clear, and in between 6 months to 59 months or 5 years rather, mid upper arm circumference below 11.5 centimeter. Okay, so see the criteria of SAM. Now to sum up, the criteria of SAM is weight for height below 3 standard deviation, mid upper arm circumference less than 11.5 centimeter, and bilateral pedal edema, which is generally pitting in nature.
So next is the pathophysiology. Okay, so pathophysiology is one term. You just remember, students, this is reductive adaptation. Okay, so the term itself is self-explanatory, that when the body is getting less calorie, the body is trying to adapt accordingly by the metabolic and physiological changes. Okay, so what are the consequences of reductive adaptation? Students, no need to mug up things, okay, just try to conceptualize, okay, then you'll be able to remember everything. Okay, so if there is calorie deficit, what happens is the fat is first getting mobilized, followed by the protein. Okay, so what are the consequences? You see, liver is synthesizing glucose in lesser amount, leading to hypoglycemia. This is a very important component of SAM, right? Next, body is not being able to generate heat, leading to hypothermia. Clear? Next, after hypoglycemia and hypothermia, we will focus on cardiovascular aspect. Okay, so what is that? The heart is not being able to pump properly, okay, leading to low cardiac output, and there will be hypotension and bradycardia as well. Okay, next, kidneys are also not being able to function properly. So what is happening? There is fluid and sodium retention. The kidney is not being able to excrete. Okay, next, moving on to the molecular level. Sodium, potassium, ATPase pumps are not functioning properly. So you know, students, what is the function of sodium, potassium, ATPase? Basically, it moves 3 sodium out of the cell and draws 2 potassium ions in, right? So if it's not functioning properly, what is happening is potassium is getting excreted through urine, leading to hypokalemia. This is also a very important component of SAM. Why, I will be explaining you later on. Okay. Next, red cell mass is diminished in the body. Okay. Yes. Next is the immunity. So there is reduced immunity, and which component, students? This is the cell mediated immunity. Okay, remember, cell mediated, cellular mediated immunity is diminished. So these are basically the consequences of reductive adaptation which takes place in the pathophysiology of SAM, right? So next, what are the three entities you are knowing? First is marasmus, next is kwashiorkor, and the third one is marasmic kwashiorkor. It's the combination of these two. Okay. So now when you are getting the three terms, you will be definitely thinking that what are the differences between these two. Yes, this is also very important question which is generally asked in Viva. So what is the difference between marasmus and kwashiorkor? First difference is edema. Remember all the students, edema. In marasmus there is no edema, and in kwashiorkor there is definite edema. This is the first striking differentiating features between the two. Okay. Next is, if you go for appearance, rather not appearance, we can take it as activity. Okay. Marasmic child will look active. Kwashiorkor child will look apathetic. Clear? Next, if we go for appetite, marasmic child will still have appetite. Here appetite is diminished. Okay. Next, if we go for occurrence, which one is common? Marasmic is more common, this one is less common. Clear? Next, differentiating feature is, if we go for liver enlargement plus, okay, liver enlargement generally occurs in kwashiorkor. Okay. Next is the mortality. Which one do you think, students, will be having a higher mortality? Yes, this is kwashiorkor. Okay. Next is the prognosis or recovery. So you see, the one which is having higher mortality will definitely be having poor recovery or the later recovery, and this will be having a faster recovery. Clear? So all these things are distinguishing features between marasmus and kwashiorkor. Okay. Now moving on to the clinical features. This is also a very important question, clinical features. Okay. So once again, do not mug up all the clinical features, just move on from head to toe, okay, so that you don't miss a single point. Okay. So starting from faces, you see there will be, in some books describe marasmic faces as monkey faces, right, due to severe wasting. Okay. And kwashiorkor as moon faces. Okay. Because kwashiorkor, as I told you, there will be edema, so there will be spelling. Okay. Next, after face comes the eyes. So there will be conjunctival cirrhosis, there may be bit of spot. I mean, you can say all the vitamin A deficiency features, okay, in the that is found in eyes. Okay. Next, go to mouth. There will be features of vitamin B deficiency again, that is angular stomatitis, chiliosis, glossitis, and so on. Okay. Next is the tooth or teeth. There will be enamel dysplasia. Yes. Okay. Next is hairs. So one very catchy point of hair is what we call as flag sign. So what is that, students? As you all know that there will be hypopigmentation and the normal hair. Okay, that is flag sign. And definitely here will be lusterless, it will be brittle hair, okay, and so on. Next is the overall skin changes. Again, the skin changes, you will be remembering two important changes. One is flaky, faint dermatosis, and the other one is crazy pavement dermatosis. Clear? So these 2 points, if you remember, that will be okay. Okay. Next, going on to the skeletal features. So yes, skeletal deformities like signs of vitamin D deficiency will be there. Okay, and
next is neurologic. So level of consciousness, as previously also I told you that the child may be lethargic, okay, irritable, okay, and there will be developmental delay. Clear? Next is CVS. What we will get? Bradycardia, hypotension, okay, low cardiac output, already mentioned before. Next is hematologic. There may be anemia, there may be some petechiae, okay. In abdomen, what we are going to get? We may get abdominal distension, okay. So yes, so these are the clinical features of SAM in detail. So next, moving on to the last part and the most important part, that is the management of SAM. Very important. So management, when you will be asked to write down in your theory question, so how will you write, student? To get good marks, you may write like this, that if SAM child is there with complication, okay, you have to manage it in hospital setting. You have to admit the child basically. And SAM without complication may be managed in community health center. Clear? You may not admit the child, okay. This point, if you are writing in the beginning, that may give you some good marks, okay. So we are going to focus on this part first, okay. So SAM with complication, the child you have admitted already in hospital. So now how will you manage the child? So basically there are 10 steps of management, okay. Yes, you heard me right, and you might be thinking now how to remember 10 steps. So well, I have made one mnemonic for you. So 10 steps are first divided into stabilization phase, okay, and rehabilitation phase. So students, as I told you, there are 10 steps. So this rehabilitation phase comprises step 1 to 6 steps, okay, and here step 7 to 10, okay. This much you remember. Next, I will be detailing you the steps. So here I have made one mnemonic. In stabilization phase, you are going to remember this term, shielded, okay. Shielded, okay. And this rehab stage, you remember this best. Very easy, yes. So what is this A standing for? Sugar deficiency, okay. So in better way, hypoglycemia, but for you, sugar deficiency. So here I am writing hypoglycemia, but you remember sugar deficiency, okay. Next, H for hypothermia. I, you have to control the infections. Very important, okay, infections. Next, you have to manage the electrolyte imbalances. Clear? This DE stands for dehydration, and the last D stands for micronutrient deficiencies. So all done. Hypoglycemia, hypothermia, controlling infections, controlling electrolyte imbalance, managing dehydration, and managing micronutrient deficiencies. So this ends your stabilization phase, okay. Now moving on to the rehabilitation phase. So what is B? Begin cautious feeding, okay. Now what is this E standing for? You have to enhance the feeding, okay, properly. Next, S for sensory stimulation. And the last T is, I have kept it transfer, means you have to plan for discharge, okay, and on discharge what the child is going to get. So this ends your management part. So students, those who are just trying to get pass marks, for them this is okay, and those who are wanting to get honors, okay, or for the PGs, all the PGs need to know each of the steps in detail, mind you, each of the steps you need to know in details, okay. So hypoglycemia, basically what is hypoglycemia, students? In SAM, glucose less than 54, you term it as hypoglycemia. And how are you going to manage this? You have to give 10% dextrose 5 ml per kg. Clear? Hypothermia, very easy to manage, but what is the criteria? If the axillary temperature is less than 35 degrees Celsius or 95 degree Fahrenheit. This is hypothermia, okay. And how you are going to manage it? Yes, skin to skin contact, increase the feeding rapidly, you have to rewarm the child, start antibiotics. Infections, how you are going to manage? So this is the case, students, where we always say that start antibiotics, do not wait for antibiotics, okay. So infections, the first line is ampicillin plus gentamicin. You may not know the doses, that's okay for you, but PGs you need to know the doses. Okay, now electrolyte imbalances, mainly I told you hypokalemia. I told you, students, that hypokalemia is very important, and why I'll be explaining later. Here, see, as because kidneys are through kidneys potassium are getting excreted, so you have to treat hypokalemia very aggressively, and that is the dose of potassium here is 4 mq per kg, okay. This is the dose of potassium you need to give, and also you have to give magnesium as max sulf, okay. What is the dose? Okay, you may skip, but you can call it like 3.3 ml per kg or 0.6 millimole per kg. Well, now dehydration. So students, until and unless the child is in shock, we generally do not give IV fluid, okay, in SAM. So how do we treat dehydration? We generally give something called Risomal. So what is Risomal? Rehydration solution for malnutrition, that is Risomal. So it's nothing basically, you just add 1 liter packet of ORS to 2 liters of water, add 50 grams of sucrose and just a mineral solution, that makes your Risomal, okay. And what is the dose? You have to give it 5 ml per kg, okay. But if the child is in shock, you have to give IV fluid. And what is that IV fluid? So IV fluid in case of SAM is very different, students. So this is, again students, those who want to get honors or the PGs, it is important only for them, okay. So RL is to 5D combination or 5D is to half NS combination. And what is the principle of giving this IV fluid? You have to give less fluid, okay, the time should be more and the fluid is different, that's the principle, that is the idea, okay. And this fluid should be given 15 ml per kg as bolus, okay. Now micronutrient deficiency, how are you going to treat micronutrient deficiency? Rather, what are the micronutrients you are going to give as supplement? Zinc, okay. Next is the copper, okay. And the others are, a lot of the things are there like folic acid, iron. Iron, students, we are going to start here, okay. After the stabilization phase, we are going to start iron. Why? Else this will generate free radical, okay, which is going to harm the body, okay. That's why iron you should hold in the stabilization phase. This particular point all of you should be knowing. Okay, now moving on to the rehabilitation phase. So we are going to start the child with feeding. So we will do cautious feeding. How? So all of you must have heard F75 diet. So what is F75, students? Basically this is nothing but 75 kilocalorie per 100 ml. Okay, just remember this much. And maybe for MCQ purpose, this is important that this is containing 0.9 grams of protein. Okay, anyways, so F75, we are going to start the child on F75. And what is the amount of F75 we are going to give? This should be 130 ml per kg per day. Remember, okay? So next we are going to escalate the feed. How? We will move on to F100 formula. So what is F100? It is providing 100 kilocal per 100 ml. Okay, and what is the protein content? 2.9 grams of protein. Okay, so we are going to give F100. So in the transition phase, we are going to keep the amount as same, and next we will escalate it to almost 150 ml per kg per day in divided doses, of course divided doses. Okay, now we will give some sensory stimulation to the child. We will provide some playful environment to the child, and the last part is we will discharge the child with proper diet. Okay, so this I guess completes your hospital management of SAM. So easy now, I guess you will be remembering by the mnemonics. Okay, and now the last part is how will we manage the child when the child is in community health center. So have you heard this term RUTF? So what is that? Ready to use therapeutic feeds. This is very important. Why? Maybe you may be asked some short notes on this. Okay, RUTF. So just remember that this is nothing but a very energy rich, energy dense feed. Okay, this is not having any water content with it, so high chance of bacterial contamination. Okay, and yes, it is made up of some like peanuts and and oil. Okay, so this basically is a replacement of F100. Okay, don't write this is F100, this is a replacement of F100. Okay, which you can give at home as well. So after having all done, we will be discharging the child. And one more thing, students, you may also be asked one important question, that is, what is the failure? What is the failure of treatment? How will you understand that your child is not responding to treatment? So basically, if you are giving the treatment properly and still the child is not being able to gain the appetite by day 4 of treatment. Okay, this is one point. Appetite day 4. One more thing is the child is not losing edema by day 4 of treatment. This is one more point. And the last point is if the child is not gaining adequate weight. So what is that? Less than 5 gram per kg per day for 3 days. So if you find all these things, then you will understand that your child is not responding to treatment. Done? So now I have come to the last part of my lecture, that is something called refeeding syndrome. Yes, because you see students, generally as days are going, more and more new questions are coming up. Okay, so it's given in your book also, refeeding syndrome. So what is that? When you are aggressively treating the child with lot of calories altogether, okay, you have given a lot of energy dense food altogether, so the child might land up into refeeding syndrome. So what is that? As you are giving a lot of feeds, so what happens is the insulin level in the body increases. And what does it lead to? Yes, it leads to the uptake of potassium in the cell, leading to hypokalemia, okay, hypophosphatemia, hypomagnesemia. There will be vitamin deficiency, hyperglycemia. Okay, but the most important criteria here is hypophosphatemia, and this is very important from your MCQ point of view as well. Okay, so I feel that's all for SAM. If you are having any doubts, so just drop it down in the comment box. I'll be happy to answer them. So if you haven't subscribed my channel yet, please do so, and we'll be meeting up very soon again with a lot of more important topics. So thank you.